So, hey everyone, we're getting ready to do some measuring here. You'll be following along with me. You don't have to do this as I'm doing it. I'd really prefer that you watch because this is something that comes hand in hand with the manual lymphatic drainage, which is something we call standardized measuring in the field with manual lymphatic drainage. It's a certain way that MLD certified practitioners measure. And say we have a client that's moved here from Europe, I should be able to take the measurements from the therapist there and continue the journey with this patient and vice versa. This would happen a lot at Dr. Lerner's clinics, in fact, because we were both in Florida at one of the headquarters, but he had a lot of other offices along the seaboard. And you know that we have a lot of people that are what we call snowbirds. So they start treatment up north, they come down south. So how does that happen? And what does that translate into? Is that it's real important that the therapist takes accurate measurements and that when that patient is then transferred to another therapist, that we are measuring the same way as the other person was. So this is standardized measuring. And we're going to show you how to do an arm and a leg. It's not just a circumferential measurement. We have to take length measurements too to make sure we're measuring in the same place that we were the day before. So a couple of things that you'll want to put on your checklist of things to do before you begin doing the measuring. Number one, make sure you have a comfortable table because your client will be in the lying position, lying supine, looking up toward the ceiling, not standing up, even though I know you see people do that online. I really don't prefer that so much because then the skin will have a tendency to hang, especially if it starts to reduce very quickly. Second thing you need is a tool, a writing implement to write on their skin. So there's a lot of therapists that do use pens and they use markers, but here's another option. How about eyeliner? The eyeliner pencils that are out there, they're not expensive. And I recommend green, blue, or purple because it shows up against skin and doesn't get mixed in. Sometimes like a pen would do, gets mixed in with any beauty marks or what have you. Sometimes you lose track of where you're actually measuring. So I would recommend an eye pencil or some type of washable marker. And you'll also need some alcohol prep pads then to clean it off after the client is ready to leave. You also need either a notebook and or I would say a piece of paper. I'd have two separate pieces of paper. You're going to see why as we do the hands-on here. I have a little secret that will help you, a little measuring secret that will eliminate some of those headaches and frustrations with the measuring. So have yourself a notebook to take notes, some extra paper. I know many of you asked, just like me, do you have a form to fill out? Well, you could use a form, but I'm going to tell you already, every single therapist that I've ever seen, including yours truly, always puts the measurements in the wrong boxes. So guys, I'm going to tell you as a professional and from experience, 23 years, you're best to write these notes down on a separate piece of paper first, then transfer them into whatever form you want to use for your facility. That will keep it more accurate. And then last but not least, I have a measuring tape. You notice that this one is in inches, okay? Now if you flip it over, you will see on the top, I'm bringing it closer to the camera, you see the centimeters and the millimeters up here, right? Here you go. Centimeters. But you know what, let's take you here where it's a little bit easier to read. Let's start down here. So just a quick course if you haven't done this before. The top half of this is in inches. The bottom half is in centimeters and millimeters. Centimeters are marked by numbers, 2, 3, 4, 5. And the millimeters are the tiny little black marks in between. And there's 10 millimeters inside of each centimeter, okay? So with the MLD, because it's from a European base and so are the compression garments that are usually fitted, we typically use centimeters and millimeters. It's a lot easier to read and a lot more accurate. So you need a tailor's tape is what I'm saying. You can get these anywhere. You know, you don't have to spend a lot of money, about $2. Don't spend a lot of money on measuring tapes, because if you're using them between patients, you're using the sanitizer prep pad, and after a short time, it will start to wear away these numbers. Your other option might be getting one that is a paper tape. There are paper tapes as well, and you might want to use them. I've got one here to show you in my therapy cart here. So if you don't want that problem, and for sanitization, or maybe someone you've got is actually leaking, they have the paper tapes. And you use it one time only and then pitch it away. But it's a tailor's tape that you need with centimeters and millimeters. So paper tape or one of these. These come in different colors too. So I'm just showing this to you. If you're a little visually challenged as a therapist yourself, I totally understand. Sometimes these come in bright pink, they come in blue, they come in white. You might want to look at some of the different colors to see and make more visible for your eye those tiny little millimeters for you to see. So again, there's different color choices. I don't want you just running out and buying tapes, but those would be the things I look for. Can I see these little millimeters and centimeters well enough when I'm writing them down? So now hopefully you have a clipboard, some note-taking paper, 1 or 2 extra sheets of paper, and you'll see what we're going to be using it for, a writing tool, and then something that you can mark your client with. And table supine and ready to go. Okay, so here we are. We're going to do this thing. I know you guys can do it. Okay, everyone. So you see I have my client comfortable on the table. And we are going to start with the measuring of the upper extremity. Remember, the measurements are really for a couple different purposes. Number one, it's to track your patient so that we have outcomes that we can actually report back to the doctors or insurance company if you happen to be doing medical billing. And in case they are fitted with a compression garment, these same measurement places that I'm going to show you are very similar to the ones that they're using for the compression garments. So have no fear. If you feel like you might have a number phobia, I promise you, if I can do this, you can too. I'm going to put my notepad up here, right on my client's stomach, and we're going to start measuring. We're going to begin on the upper extremity. All measurements start at the tip of the middle finger, right here, okay? So if ever you're wondering, do I move my tape up the arm? No, you're always gonna have it right there at the tip of the finger. So that little silver piece is gonna go right there. You see it on the tip? Let me move this over for a moment so that you can see it. See the silver tip? We're going to put it right here. And our first measurement, first length measurement, is we're going to look for the metacarpals. And on Rachel, it is 10 centimeters. So length measurement number 1 is 10. So I marked it right there at the 10. If you didn't see it, you can see a black mark there now. The second measurement is going to be right here at the wrist. And you still have this measuring tape, this little silver piece is still down here at the end, down by the middle finger, okay? I'm going to bring you in a little bit closer so you see this even better. Okay, there it is, silver tip. There we are, 10 at the metacarpals. And now for the wrist, you're gonna look for the bony prominences. There we go. And that's gonna be 18 centimeters. So measurement number 2 is 18. Measurement number 3, and watch what I'm doing. I'm just gonna put my finger down on it. And there we go. Measurement number 3 is at the elbow. And that's 38. Okay, so all I did was I put my finger on her wrist and stretched the tape up. That way, you've only got 2 hands, so we got to figure out how to maximize every moment. Okay, so number 4 now is going to be right where this sleeve ends. This sleeve ends about 1 inch down from the axillary fold. Okay, and that is going to take us to 49. So I know if she was going to wear a sleeve, it would be at least 49 centimeters long. So here you go. You should be able to see the marks here. This is 1, this is 2 at the wrist, this is 3 at the elbow, and 4 is 1 inch south of the axilla. Now, before we get these circumferences, now that I have these lengths, say this is my client now, and in 3 months, I'm gonna see her again. I have this written in her chart. So when I go to measure again, I will be measuring exactly in the same spot, which is going to give us more accuracy when we're dealing with their circumferences. I know a lot of people take circumferences, but if you took it here today and somewhere else tomorrow, then you don't really have a good baseline of comparison. So that's why we're doing it like this, okay? So now the lengths are established, but the one length a lot of people are confused about, let me just show you for a minute, back this up. The one that gets people most of the time is this, what we call the axillary measurement. And that's because the measurer is measuring way too high. They're trying to go all the way up into the axillary pit. And if that was to turn out to be a garment, the garment's gonna roll. If you're way up here, the garments are not cut on an angle. They're cut like a regular sleeve. In fact, let me show you my sleeve. They're cut like this. They're cut about 1 inch down from your axilla. So that's the #1 problem with most compression garments I see, especially upper extremity. It's that they were measured too long. And this will help you. If it helps you visually to actually ask them to come in with a short sleeve to keep you from going up too high, just like we did here, then I would do that. Because once a garment is cut, they can't just go and give it back. So we don't want to waste time or money, right? So now you've learned the secret. When you come here to this upper extremity, just remember 1 inch down from the axillary fold, or have them wear a short sleeve so you visually see it. Don't worry if it comes in a little bit short. Garments stretch, they're made of rubber. Okay, so they can always stretch, but the one thing we can't do is shorten it if it's too long. So now that we have our metacarpals, our wrist, our elbow, and our axilla, now we're gonna go around and get the circumferential measurement. And there's a little technique to doing this. So when you put this around the hand, and we're gonna leave the thumb out of this, this is just around the metacarpals. We're gonna wrap it around, and watch what I'm gonna do. I'm gonna do a little pull. Pull, 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 gently release, let it stop, there we are. and I see 18 centimeters and 2 black millimeters to the right. That would be 18.2. So I've got my first circumference, 18.2. Now, when you use the technique this way, it's going to prevent you from either pulling too tight or holding too loose. That's why we worked with a team to come together with the researchers on a way to make sure we were all measuring the same way. And this worked really well. This was 15 centimeters, 9 millimeters. So what would that be? 15 centimeters, 9 millimeters is 15.9. Then we're going to come up here. Just make sure if you're coming to the elbow that the elbow is actually included. I like to make sure, that's why I'm standing this way, to make sure the olecranon process is in there. And we'll bring it down a little further so you can see it better. 1, 2, 3, let it release on its own. And here's where it's going to stop. We're at 26 centimeters and 3 millimeters, so 26.3. And then last but not least, we're going to do the axilla. If you have someone who has a kind of a larger mass of tissue, it's okay if you pull it out just a bit so you can fit this measuring tape underneath. Okay, here we go. 1, 2, 3, and it ends up at 31.9. So I've got all my measurements for this arm. So obviously you see that this takes a little bit of time, right? This is not something that you do very quickly because you're trying to be accurate. So this, I hope, will answer the question some of you are wondering. Do we measure every limb? No, because you're given about 15 minutes per limb. So if you did all 4 limbs, your whole hour would be gone. Now, if you do choose to do that for your client, that would be an out-of-pocket expense. They would come a day ahead of time. So sometimes we do it for those who really ask for it, request it. But insurance-wise, you're not going to be able to do 4 limbs if they're not all affected. So we tend to focus in on the limb that is affected because you got 15 minutes to do measuring, and then you got 45 minutes to do your MLD. And when you get really good at this and you start building up speed, you'll be able to measure a limb in about 5 minutes, and you'll have more time to do lymphatic drainage. So right now, more than measuring every limb, I'd rather you just focus on the limb you're working on and work on just doing it correctly. All right, so now we're going to the lower extremity. So let's take a look here. Okay, so my friends, now we're going to do this lower extremity here. And very similar to the upper extremity, we're going to start at the great toe with the silver piece right next to the toe and bring it down to the metatarsal heads. That will be measurement number 1. And for Rachel, that looks like it's going to be 7 centimeters. Right there. Yeah, because that will take us right across the metatarsal heads. So this is measurement number 1. And now we're going to come and do the last 3 measurements. You're going to want to be, I'll show you, I'm going to be on the floor. This is where I can see it best and be able to take my tape. I'm going to turn the foot in a little bit. And just like you would hold a level, so here's my silver tip is at the end of her foot here, okay? So it's not down by the heel, it's not way up here. It's just like a level when you're holding the tape straight. It should be just like this. So here's my 0 is at the bottom of the foot, right at the edge. And now I'm going to go to the ankle, which is going to be 10 centimeters. That's measurement number 2. Now, holding on to this and taking it all the way up to the knee, this is going to be measurement number 3. So that is going to be 51. So make sure we get them all down. So measurement number 3 is the knee. 1 metatarsals, 2 is the ankle, 3 is the knee. And now for number 4, very similar to what we did with the axilla, you want to be at least an inch down from inside this groin. So actually, I would put this almost like it's a short. It should be straight across. If someone's wearing like a bathing suit cut or something's cut up on the side, that would not be good. I would have them come in with a short to help make sure you're at least 2 fingers down from, there we go. Sorry, Kitty decided to join us. But that would take us right to number 4. And that's going to be 65. There we go. So there you have it. So 1, just to review, metatarsal heads. 2, the ankle. From the bottom of the foot to the ankle is number 2. From the bottom of the foot to the knee is number 3. And from the bottom of the foot all the way up here to 1 inch inside of this groin, about 2 fingers will take you in there. Now we can get the circumferences. I'm going to show you a couple little tricks here. So like we did before, we'll do the method that we did with the research team, which is just to put the tape around, gentle squeeze, 1, 2, 3, relax the tape, and that is 22 centimeters and 4 millimeters. That would be 22.4. Around the ankle. That's it. 1, 2, 3, and we have 25 centimeters and 3 millimeters. So that's 25.3. Now, when you're going up the leg, because this is an average size leg, right? If you're dealing with actual edema and it's swollen, what happens when you're moving this tape is it tends to stick. So rather than pulling on the tape, just press down into the table. You see that? If I just press down into the table, I can get up and down without pulling the skin. I tell you, you'll look like a real professional when you're not pulling their skin. They'll be very happy about that because the patients know these details. So just push down and you can move your tape pretty easily. Okay, now we're coming around the patella. Here we go. 1, 2, 3. Let it relax on its own. And that is 43 centimeters and 5 millimeters. So that's 43.5. And then last but not least is going to be that thigh, upper thigh measurement, which by the way is the second most common problem area because again, the therapist measured that one too high. Instead of stopping here, they keep going up the lateral thigh. Let me show you. It needs to stop here like you're wearing a short. If you go beyond that, the garment will definitely roll because it's cut this way. So if you've got more of this girth measurement up in there, it's going to roll down on itself. It has no place where else to go. So we don't want that problem, right? So we're going to measure here. And 1, 2, 3, release. And it's 59 centimeters and 5 millimeters, 59.5. So we've got all our circumferences now. But that extra piece of paper, I wanted to show you this. Like I said, on this limb, this is like an average limb. This is not a difficult limb at all. It's not a challenge with great big lobes and things like that going on, but you may get one of those. And when you do, this is going to be your problem solver. So let me show you. If I have someone that has great big lobes and I'm trying to use this measuring tape to get around the limb, those big lobes will sometimes engulf the tape. Tape will actually slide into those crevices of the limb. So instead what we'll do is we'll take a piece of paper like this and then watch what happens when you use the measuring tape. I put the measuring tape underneath this piece of paper. And so now I can do this. I can lift it up just a bit. There you go. And now when you put your measuring tape, you can see that this piece of paper would actually fill in. Wherever those cracks and crevices would be, this tape is not going to slide in there because there's a piece of paper here preventing it from happening. So what you have is a nice seal and a very even, flat surface. You might have to add a millimeter for the piece of paper, but let me tell you, measuring can get really out of hand. It can get really challenging, especially if it's not something that you do every day. We got to be really skilled with this in the clinics because we were doing it daily, but I've watched therapists really struggle. And that's, again, a piece of paper would have solved a lot of the problem and the chafing and the sticking and all this kind of stuff. So hopefully now you've taken some good notes on this and feel good about it. Even if you're not a numbers person, even if you don't like this, can I tell you that some of the best jobs in MLD today, especially with doctors, you know, when they hire someone on to do MLD, they're not going to hire someone else to do the measuring. Their expectation is that their MLD therapist can do all these things, kind of a one-stop shop, can do the MLD, can do the measuring. And if you can do that and handling all the scar tissue too, then you're worth your weight in gold to them. So I'm glad you took a few moments just to see this, because I've watched and seen some therapists lose their job on the first day. Not anyone I trained, but from other places who didn't know how to do this. So now you do. So now how do you like MLD standardized measuring? I think we have some good motivation for wanting to know something about it, even if you don't use it every day. But at least you know the protocol now. So with that said, my friends, we're going to take a break here and we'll be talking more in just a few minutes.